All right, good morning, everybody. Welcome to our June PFA Network Coffee Chats. My name is Laura Jackson, and I'm the Director of Community at PFCC Partners. We are recording. We do add these to our YouTube channel, so if you ever miss a coffee chat and you'd like to go back and watch the recording, you're more than welcome to. Or if you'd ever like to revisit a discussion, you can head over to our YouTube channel and check out the recordings. We do have live transcript on and available if you need it. At the bottom of your screen on your menu, there should be a CC, and that'll turn on the live transcript for you. These are our agreements we go through before each meeting. We want this to be a safe place for everyone in the PFA network to come to. So we want to practice active and empathetic listening and sharing. We want to challenge the idea and not the person. We are both teachers and learners. We take space and we also make space for others. The stories that are told stay, and then we take the lessons of those stories with us. We use I statements. One person speaks at a time, and we want to be here and present now. All right, we'll do a little welcome introduction. So we'll do a round robin. So let us know your name, where you're calling in from. And the question we have today is, what is your favorite animated movie? So my name is Laura Jackson. I'm the Director of Community of PFCC Partners, like I said. I'm calling in from Eugene, Oregon. And my favorite animated movie, that's a tough one. It's been a while since I've seen a new one. I guess since this one's on screen, I will say Encanto is one of the newer movies, and it's beautiful. The artwork in it is it's a beautiful, beautiful movie. So I'll say that one. I will start here on my screen at the top of my list. I've got Marty.
Hi, my name is Marty Carty, and I am in the Boston area. And I'm looking at movies. I'm trying to see the last time I saw an animated movie with my grandchildren who are now in their 20s. I almost have to go back to my old cartoon days. Because I really don't watch too much of the newer things that are out, but I know that they make a big difference. And I think that's a great question too, Laura. A nice icebreaker.
Thanks. All right. Well, thank you, Marty. Thanks for joining us today. Nancy.
Hi, Nancy Brockman from McIntosh, New Mexico, which is about an hour east of Albuquerque. It's been a very long time since I've joined the coffee chat. Life's just had too many interesting things. And I'm hoping I can get the volume up a little more at this end so I can hear better. I didn't test it. I just went to the link and jumped on. Oh, the movie, I don't even know. Can't even put them in my head what was on the list.
Well, thank you for joining us. We're really glad that you're here. After a little while, we haven't seen you. Karen.
Good morning. I'm Karen Fernandez, and I live in Dallas, Texas, formerly from Massachusetts. I grew up in Newburyport, Massachusetts. And my favorite animated movie, I'm not a movie person, so I'm going to go way back when and say Bambi.
Oh, nice. That's a pretty movie too.
Yeah, that's great.
Yes, thank you, Karen. Elena.
I'm Elena Tillman, and I'm calling in from the Southern California area. And like most of the others on the call, I'm not into too many of the new movies, but I love watching old TV. But my granddaughter has gotten me into Moana.
Oh, yes.
So, but I guess she's moving on to The Little Mermaid, so I guess that'll be the next one.
That's the next one. I love it. Yes, Moana I love the music in Moana. It's beautiful music. Thank you, Elena. Ashley. Ashley, you're muted if you're talking. We can come back. We can come back, or you can add into the chat if your audio is not working. Your introduction. All right, Lindsay.
Yeah, hi everyone. Happy to be with you on this lovely Friday. I'm Lindsay Galley. I'm the Vice President of Programs at PFCC Partners. I live in Sacramento, California, up north. I have an 11-year-old, so we're almost phasing out of animated movies.
Yep.
So we just saw the new Flash movie last night, which it's not animated, but there's definitely a lot of computer generation in it. But I'm with Elena. I love Moana. We've taken my son to Hawaii, and on the whole flight there, we just watched Moana and kind of get in the mood. I love that one.
Yes, it definitely gets you in the mood for Hawaii for sure. Thank you. All right. All right, I think I got everybody. We'll go ahead and move on. And Elena already introduced herself, but Elena is coming to us from the California Coalition on Family Caregiving. She's going to talk to us a little bit about their program. So Elena, take it away and let me know when you want me to move the slides forward. Oh, you're muted.
To
There you
further
go.
introduce myself, I am a wife, grandmother, great-grandmother, and a former caregiver. And about 17 years ago, God took us on a journey that we never expected, caregiving, that lasted 12 years, caring for my mother, my father, my aunt, as well as raising our sons. And so we were sandwiched. And one of the things I'll say here is that when people hear the term caregiving or caregiver, oftentimes I think they get the wrong idea that it means, you're going to be, changing someone, doing all the medical stuff. Well, it's part of it, but it can range anywhere from just being that person who puts everything in place for someone who can't do it themselves, as well as up to the level of maybe actually having to do the hands-on caring. So it has a lot of connotation, but it's a rewarding thing to do if you go into it with the right attitude. And I guess having the right attitude carries us through everything in life. And so I try my best when I'm talking to people and sharing what we went through to say that when we look back on it now, that we wouldn't have traded it for anything. And God took us through it. And we're here on the other side of it now. And now trying to help be an advocate to bring other people into it. And one of the things that I would like to say is that, and I'm going to read it because I don't want to misquote her, but Rosalind Carter said, there are only 4 kinds of people in the world: those who have been caregivers, those who are currently caregivers, those who will be caregivers, and those who will need caregivers. And so at some point, I think we all will find ourselves somewhere in one of those categories. And that's why, for me, I've taken what we've learned and moved it into advocacy, because unfortunately, there are a lot of people there who don't have family to even help them. And so this is where I've kind of gravitated to. And I am in my 70s, but we're trying our best. We have to get our young people to get on board, even if it's just in the role of advocates, because it's important. And I'm going to share something before we move on. Advocacy helps everybody. And as you see on the screen, the mission for the California Coalition on Family Caregiving is to advocate for California policies and services that support diverse unpaid family caregivers and their care recipients. And again, like I said, a lot of people don't, excuse me, understand what's going on when you hear the caregiving, so they shy away from it, not realizing that to be an advocate just may mean picking up your phone and calling your representative and saying, please support bills that will help families. Our role mostly with this coalition is because of the aging population. But some of the policies, and I'll be sharing a couple of them later on, also affect families who have children because they're in the workforce. And so advocacy enables caregivers to be heard, influences laws and policies, and also can, because of partnerships such as with groups like PFCC and others, you begin to find out that there's a lot of resources out there that people aren't even aware are there and can really make a difference. And as we said, the mission for the coalition is to advocate, but the vision is that they want to create a robust caregiving support system that ensures caregiver well-being, because that's the other part of it. We have to make sure that the caregivers stay healthy, caregivers stay financially stable, because if they're not, it affects, of course, the people they're caring for. So, Laura, you can move on to the next one. And okay, oh, before we jump to this one, now this coalition is new. And hopefully all states and areas will start to, I'm sorry about that. We'll start to have coalitions, bringing people together, such as yourselves on this group. You know, just in this small group, how many states and areas are being represented? And so, of course, some of the policies that we're looking at would also be on a more national level, so that people can move to other states and know that they don't lose their benefits or, you know, will have to start all over. And the coalition chose two bills this year that they're advocating. And in the hopes that, of course, as it grows, that more bills can be supported. And as you saw in that first slide, there's only 35 members right now in the coalition. But as I said, this is brand new, so we're looking to really recruit more people. And you can go on to the next one. One of the bills, okay, and as you notice, one said A, B, one said S. This is the one going through the assembly here. And it's going to be paid family leave for designated persons. Right now, there is family leave for, you know, if you're the parent, your children are. But again, as I mentioned earlier, there are a number of people who have no family. And so they have maybe a designated friend who plays that role. However, that friend is not recognized, as in many places, as that caregiver. So they are not able to take paid family leave. And so that puts a burden sometimes on a neighbor even who wants to help out, but cannot afford to take off to take that person to an appointment or to care for them if they've come down ill. So this is trying to help expand who can be considered that caregiver. And that way would allow them to possibly to have more people that would take on that role of helping others. And like I said, this is going through the assembly. And right now it's kind of moving forward, and the representatives that I've been privileged to be on calls with seem to be behind it. And one of the things we're finding in both assembly people and senators, oftentimes now a lot of them have become caregivers. So these bills and all become near and dear to them as well. Okay, and you can go on to the next one. And this is a similar, this one would be for paid sick days. Something that I didn't realize is that people who are working, I just, and many people have also assumed that they have, maybe at least one sick day a month. Many places have none. And of course, part of that, like I said, is determined by the size of the organization and all. And they're trying to increase the minimum number of paid sick days from 3 to 7. And within that is the hope that, okay, if I have 8 hours of sick time, I can maybe take 2 at a time to not have to take the whole day. And again, to be able to then spread it out and give more flexibility when that person has to take a loved one, take off for a loved one. And you can go to the next one. And I think hopefully I explained kind of a little example of what we're doing. And even though you all are in other states, they're welcoming people to join the coalition. And because again, it's looking at you're sending word that, hey, these people need it, these people need the help. And since the caregivers are unpaid, it can affect the economy. So we kind of, mentioned to them, like, you don't want your constituents to have to lose their jobs. So help and be there for them. And so you can see at the top, the website is cacfc.org. You can go on that site and see a little more about what the work, is being done. And there's a place on there where you can join. And like we said, they're welcoming people from all over. And I guess one thing I failed to say that I have become the Southern California advocate and representative for the coalition. There are just a few of us right now in the state, and they're looking to find others who will cover all the different counties, because California, like many states, has so many different counties. And, we can't cover them all by ourselves. So I'm opening up. Does anyone have any questions and for me?
Thank you so much, Elena. And I did put the website in the chat if anybody would like to use that. And we'll also send it out in follow-up. Do we have any questions for Elena?
Or comments or suggestions? Maybe there's something that you all may be doing that I can take back to the coalition and say, maybe we can add that to what we do.
We do have some questions from the registration here. Someone asked, how do you choose coalition members?
There is a steering committee that is made up of people from all over the state. I don't know all of the representatives on. I know we have some from Alzheimer's. In Los Angeles, we have actually 2 Alzheimer's group. So I know some of them from the Alzheimer's Los Angeles. And the people on the steering committee have been doing this work for a lot of years, some of them as much as 20, 30 years. And so they have a kind of a roadmap of what they're looking for and the type of people that they are looking for to, to join. We did have to apply, and we submitted our resumes, and, little example of work that we do. Besides being the former caregiver, I have also, I run 2 support groups in the area. I used to be on Alzheimer's used to have an ambassador program where we met once a month with our senators and congressmen to make them aware of bills or things that people in the community needed. And then I volunteer with an organization called Leisure Care Connection, Alzheimer's Los Angeles, and then the Los Angeles Caregiver Resource Centers. We have here 11 in the state, and then I do some outreach with them as well as run a support group under their umbrella.
Wonderful. Lots of great work you're doing. Lots of
Thank
great
you.
work.
And
Yeah.
it's,
Go ahead.
as I say, that's, and I know, and I mentioned my age because of the fact that a lot of people are saying, oh, I'm too old. You're never too old. And actually, the wisdom that gray hairs bring are really needed, because a lot of our young people who are the ones who are sitting on these committees or the representatives, many of them are not aware of what happens with people. I know some people have been, around their grandparents and all, but not everybody has had that privilege. And so they need us gray hair people.
Absolutely. Most definitely.
Yeah, Elena, I just wanted to speak up and share how, I completely agree with you. There's so much that, we can all learn from one another's lived experiences. And I love that you're leading this for California, especially since we're in the same state. So you had the bill that you're focusing on here today is on the sick leave. And I see that there's a lot of other efforts that the coalition is working towards. Just curious, and I think you mentioned a few, but just curious, what are some of the other things that the coalition focuses on for caregivers?
You know what I'm going to say, Lindsay, I'm so new to it myself.
Okay.
The main focus, though, is these bills. These are the two, I think there were 30, if I recall, bills that are being proposed for the area, but the coalition realized that you can't tackle them all. So they picked these two to sort of highlight and to see how well it works. Like I said, they have had a call-in campaign where people could call their representative's office and say, please get behind these bills. And seemed like this kind of worked because these two have kind of moved along fast.
Oh, great.
But there's many others. And also the coalition also looks to have people bring, concerns to them. And like I said, you can't tackle them all. And as you can see from our numbers, it's so small. But the coalition has been in place less than 6 months.
Oh, gotcha. Okay,
So,
really. Okay.
yeah, so it's
So
growing.
more to come.
Yes. And there were many that we looked at that, when we sat in on the call and they went through all the different ones that, like, oh my gosh, I want to get behind that. I want to get behind that. And you can't get behind all of them at one time. But it also brings out the fact that sometimes when you start looking at them that way, you realize that maybe a couple of them could be merged. And, and so accomplish more under one title. So, yeah.
Very interesting. Well, hopefully, at some point you can come up to the Capitol here. And I can meet you.
Well, if not me, there's several of the people are in your area.
Oh, I'm sure. Yeah.
And hopefully they will, especially after this, can maybe, kind of say, okay, guys, contact Lindsay. She's up in Sacramento, or, again, like I said, this is the two-way street that I can bring, or others can bring people to you all, and vice versa.
Right. Absolutely. Yeah. Very exciting.
Linda's got her hand up.
Go ahead, Laura. I was just going to add something. I should have raised my hand. It's Marta.
All good. Linda, go ahead.
Hey, everybody. I'm not going to be on camera today. I'm not camera ready. One of those days after a long work trip. But I'm sorry too, I was late in dialing in, so I may have missed this. But knowing that you all, Elena, are new and just got started, it made me wonder if by chance you all have connected with the Independent Living Resource Center, either in the LA area or the one that is for the Tri-County area just above you, starting in Ventura County. And the reason I bring it up is that my daughter works for the Independent Living Resource Center for the Tri-County area, and she's in the Ventura office. And she works on disability services tied to public health. But prior to that, she was working on their contract regarding the aging population and those with disabilities. And so that might be a group to connect with, because they focus on young people with disabilities all the way through the lifespan, and those who are aging with, including dementia, Alzheimer's, et cetera.
It sounds like it. Can you, maybe through Laura, you could again give me the information for Linda, and Linda, you can pass on about your daughters, and I will then in turn pass it on. Like I said, I'm doing LA County. I'm not sure if we have a representative doing Ventura, but if not, your daughter may be somebody or someone she works with, we could bring to the to the coalition.
To the conversation, yeah.
Yeah.
And they call, forgive me, because I'm not remembering my California counties very well. I don't know what the other two counties beyond Ventura County are in that Tri-County services that they take care of, but it's Ventura is one of them. But anyway, I'm going to put the her name and the link to them in the chat, Laura, and then I can also, you know, to connect in other ways. But hopefully that'll be a little bit of help. You never know.
Yeah.
And
you know,
by the way, I'm gray haired too.
okay. Their next meeting is going to be next week.
Oh, okay.
I think, or yeah, well, if not next week, the final, because it's toward the end of the month.
Okay.
But
right.
maybe Laura, I can also, I don't have the date in front of me, but maybe I can pass that on to you, and you can pass it to everybody. And you know, welcome to to join the meeting and see what happens.
Great. Yeah, absolutely. I'd be happy to pass it along. Marty, go ahead.
Thanks. I just wanted to say UCLA has a really good aging group. They were also sponsoring a PCORI dementia care grant. And I think I don't have it right off the top of my head, I lead the patient stakeholder group. Nationally, we actually have 4 sites that are part of this study. But the big focus is on caregivers, because that's the result, one of the major results that's come out of this 2.5 years. So you can look up DCare, and then if we get an opportunity to connect, I can connect you up with the people at UCLA, which might be helpful at least to support your work in the California area.
If I'm not mistaken, that might be Monica Rodriguez. No, not Rodriguez, Monica Moore. But please send it, because I think that one of my one of my long-term friends is over at UCLA, and I think that may be the program she's part of. Again, to be honest, there's so many going on, and trying to keep all the acronyms in my head doesn't always work. But it sounds like the one that we were just just talking about.
Mm-hmm.
And so, but please send that on, because, not even just for the coalition, but in terms of, I think, you heard me mention support groups. I joined a support group as a caregiver all those years ago. And like I said, now I'm leading 2 of them, but caregivers need that emotional support. And oftentimes they don't even realize that just sitting in and talking with other caregivers can make a difference. And so we're always looking for, for other opportunities or programs to pass on to them. And like I said, I know UCLA is one of the ones that I personally partner with. And again, those of us as the coalition members, we're then bringing other organizations to the table.
Mm-hmm.
But, you know, I asked the question, I know Marty talked about what she's involved, but are there any other people on here who are part of any kind of coalition or on that? Again, like I said, maybe we can take back, you know, I could take back to the group and, you know, and, you know, see maybe there's some strategy that they could share, especially a group that may have been established longer than we have.
Yes, Nancy.
Hi, as I'm listening to Elena, I'm thinking, I don't even have any clue what kind of groups there are around for people doing the same thing I'm doing, other than people that I see in my various organizations that share some of the same tasks. My buddy just comes along with me. We're like the Bobbsey twins when we go places. And so it's working for us. But there are probably times when I would benefit if I dig out a group that's nearby. I will be asking that question of the Veterans Administration because of the involvement there. But sometimes that takes extra time.
Nancy, there's I'm not exactly sure what they do, but I get a newsletter from a group in, I believe it's in New Mexico, called Duet. And I know they put on webinars, they have speakers, they highlight authors who they've shared books that are about caregiving and things that can help. And they're either out of Arizona or New Mexico. But again, like most things in which is one of the benefits I'd say came out of COVID, is being able to do like we're doing today, Zoom. And
Exactly.
I've gone on a number of their calls and they've been awesome.
Well, that would be good to know. If you can get that passed through Laura or Libby, and I would be delighted to look at it at an email and dig in and learn more.
Okay, I will put the website for them when I'll send it to Laura to pass on.
Thank you.
And not just for Nancy, by the way. Again, this is just another resource for all of us.
Yes.
I'm going quiet again.
Yeah, we call ourselves giant Lego pieces, just connecting people and
Yeah.
resources together. So that's great. And I see Karen's comment in the chat. Karen, I know you do a lot of advocacy work. Curious if there's anything that you might be able to share.
I've been involved with DES advocacy since the 1980s. We are a Facebook group. We support each other that way. The mission of DES Info Association is education of healthcare providers. Our motto is knowledge is power, and education is so needed to make sure that the DES exposed population gets the care and screening that they need. So it's totally, it's a free membership, so anybody can join. We have 22,000 followers around the world. So it's something that we work on as unpaid volunteers 6 days a week. So, we will discuss our situation in various groups like here. But we provide Zoom meetings periodically, and people reach out to us through our email addresses. Right now, we've got a pamphlet coming, which I'm quite excited about. We started working together with a researcher, and we're putting together a pamphlet so that people can have something easy to print out to give to their physicians to let them know this is what I need for breast cancer screening, and this is why, and we'll provide the research. So again, we're providing the research to the physicians via their patients.
Wow.
Karen, you bring up something that I have always mentioned. is that a lot of work has been done in the past and, with the UCLAs and the USC and all the biggies, but no one has really talked to a lot of physicians. And I'm finding that in many cases that families don't always, doesn't mean that their loved one has been hospitalized. So they're kind of under the radar. And so I know with my, the physician that we had for my family members and now my husband and I, oftentimes I have mentioned to them about, say, the resource centers or something going on. And so periodically his office manager will actually call and ask, he says, do you have some of those brochures you can send us so we can pass on to our clients? And that's an area that I really think has gone untapped.
One of
And
the things that was suggested to us as I was sharing or developing this pamphlet is put a QR code on it. It was like, well, that's a novel idea. I got to figure out how to do that.
somebody said, go to one of the elementary school and ask those little kids, they'll tell you how to get QR codes.
Probably so.
But one thing that we also shared, and I shared with somebody just yesterday, that because a lot of the family caregivers are older, that we need the QR code and the websites.
Right.
Because a lot of people don't really navigate using QR codes if they're older.
Yeah, that's my concern because we are caregivers to my mother-in-law who is in assisted living. She is 93 and has zero computer literacy, doesn't have a cell phone or anything. It's pretty hard to interact with it. Plus she's deaf. So it makes it hard for her to function in our current day. It was so funny during the pandemic, she would say, and she was suffering from lymphoma at that time. She would say, I just couldn't hear the doctor. Well, the thing is, we really discovered she reads lips because the doctors, everybody was wearing masks, so she couldn't understand them.
Yeah. See, those are the kind of little things that people just don't realize.
No.
How it affects what's going on. And something that I've seen change and I'm really happy about is that a lot of the physicians are acknowledging the caregivers or the care partner or, whatever the title is, whoever your advocate that goes in with you. And that has made a big difference.
One of the things I'll share, in addition to being an advocate for the DES Exposed, I'm also a nurse and I have a healthcare consulting business and I work with hospitals across the country for quality and patient safety. But in addition to that, I formed another company called Advocacy for Medical Transitions. And my hope there is to work with clients, patients, and or families, because you go into the hospital, and a lot of you know this, they talk a different language. And by putting me on their EMTALA forms, I can speak with them to the physicians and give back, interpret into plain English. And if they're, what's the difference between inpatient observation status? Why am I getting this bill or that bill? So it's a support that I like to provide to patients that are in need at that time during hospitals and going to different levels of care.
One thing when I first started doing some of these, calls and all, people in, physicians' offices or medical staff who was on the call would talk about all of their non-compliant patients. Well, what you just spoke to does that. If you don't understand what's going on, you're not going to be compliant. But if you don't feel that you're heard or respected, you take what they're saying, you go home, and if some people don't even make it out of the parking lot, they toss away what the doctor said, because it's like, he wasn't talking to me. He's talking over my head. He doesn't care. And so they go home and don't care.
As we moved into our current day in 2023 with all the portals we have and we must fill out and so forth. And I was just helping a neighbor and you go through the documents and there's a lot of stuff that it's really not important that they print out. We're wasting trees, just give them the important information. So I went on to their portal. I said, look, you read the progress notes. Don't worry about the other stuff. Because the patient had been in the hospital, read the progress notes. Then you're going to know what the physician was thinking and documenting. When you get the summary and so forth, it's all high level and a lot of the stuff they don't pay attention to. So part of that is education of the patient and families, where to go to look to seek for this information. This person had some blood clots. And so I said, look, it's here, take a screenshot of this. So you have that in your hand. So when you go to another doctor, you can say, look, this is where my blood clots are. Because they're not going to remember what particular vein they were, but they've got some doctor here. And I shared with her, I'm a patient too. I have 50 plus kidney stones, just sharing. And I went to my urologist because I had been to a big medical center and they had some really great notes. And so I went to my urologist, but I printed out everything. I said, and he and I have a good rapport and we kid. I said, so you read my notes from the other hospital? And he chuckled and he went, no. So I had it printed out and I went, here you go. And he knew I would do that. And so he goes, oh, okay. So you have to be your own advocate, because don't just think these care providers are going through all these medical records to know everything that's wrong with you. They're not.
Yeah. So true. And oftentimes, you know, they're doing all this electronic stuff and say, oh, we're on the same system now. And I went to a doctor the other day, a while back, and he's like, oh yeah, we're on the same system, but we can only see a certain amount of what they put up. So what's the whole point of being on the same system if you can't pull everything up?
One of the main systems that hospitals are on are called Epic.
Yes.
That's the major platform. Historically, what has been done is it's so costly, right? It's very costly, millions. And they buy what they can afford. And then the hospital has to spend all this kind of money to recreate things and make it their own. So one Epic system isn't the same as the next Epic system and is not the same as the next Epic system. Unfortunately. I can see that because now I'm in a few different Epic systems. I'm going, oh, they're all different. This one's a better one.
I carry, like you do, I make copies of a lot of the things. And then we have one of those pocket folders. And, you know, every time I get something or we go, we'll ask, can we have a copy of it? And I drop it in there.
Yeah.
And then if I have to go to a new doctor or a specialist, I'll just grab that up and say, you know, have you seen this? Have you seen this? And yeah, to make sure we have it, because they don't often talk to each other. They don't know each other. We're blessed in that our physician, he works with different specialists, and he'll have one, you know, eye doctor and one gastroenterologist, and he encourages you to go to them. You don't have to, but that's somebody he's partners with. So they'll talk to each other about you, where somebody in another, you know, practice may not even have the time or the interest. So.
Right. What I have chosen to do, I've had many health histories, things going on in my life. And so I'm used to reviewing medical records as part of being a nurse, and you see the history and physical. Well, I do my history and review of systems. So I have that all done. I go from head to feet and what's happened to me. So I can hand that to them. In there is my medication list, my medication allergies. I'm not rewriting that for everybody. Here it is. You want electronically? Sure, I'd be happy to send it to you electronically. But that way, they've got my whole story right there in a nutshell. They don't have to go through anything, but that's what I've chosen to do. And it's worked well going to my new specialist that I've had to go to.
That's what I encourage the people in my support group to do, you know, for the loved one that they're caring for.
Wise wisdom. Alana, wise wisdom there. Mm-hmm.
Yes, very good, very good. And thank you, Karen, and for sharing all that. I think very, very important discussion and important topic. And I like what Lindsay said in the chat of taking charge of that is a great way to be an engaged patient and member of your care team. And if you're a caregiver, doing that for who you're caregiving for as well is a great way to be engaged. And thank you, Elena, for bringing this to us today and talking about the importance of caregivers and caregiving, and the coalition that you all are bringing forward is you're going to be doing amazing work. You're doing amazing work now, and I look forward to what you all do in the future since you're just getting started.
Well, thank you for inviting me, and hope I kind of, covered everything. And like I said, but,
I
be
think
great to
so.
exchange, information and, kind of keep in touch.
Absolutely. Yeah, I've got a list of folks to connect you to. And we will also be sending out a follow-up too with the recording of this and any resources that we share. So thank you, Elena. Thank you again for presenting today. I did want to move us forward here. We do have one more thing. It's an opportunity to comment addressing social needs electronic clinical quality measure. And if Lindsay, if you would like to take it away, I'll pass it over to you.
Yeah, just really quickly, and apologies for my camera being off. My internet has been kind of off and on the last couple days, so I don't want to have my video freeze and a silly face or anything like that. So but I am here. So I just wanted to share this because I thought it was really interesting and exciting. So CMS, the Center for Medicaid Services, they are currently working with another group to redesign a measure. So the measure will basically kind of scale or give points to providers who are actually connecting patients with social needs that they're sharing that they need. So the measure is called Addressing Social Needs, and it's an electronic clinical quality measure, or ECQM. So what we've seen recently, so providers, healthcare organizations, hospitals are screening for social drivers of health, and that happens in a clinical setting. But what we have heard from patient family partners and from hospitals is the gap between that screening that happens for those social drivers and the actual connection to the social needs within the community. So the measure, it's actually being redesigned to ensure that patients are, that gap is being filled and that patients are being connected to the social needs that they screen positively for. There is a whole, what's it called? Measure specifications that basically just describe what providers are going to be, or what's going to be measured of the providers when it comes to not only screening for social needs, but then the follow-up and connecting patients with social needs. So really closing that gap. On the next slide, I think I had a few more details about the actual measure. So I mentioned the providers are being scored based on 4 social need domains. So the first is food insecurity, then housing insecurity, transportation, and utility. And within the measure specifications, they actually define each of those. So what does food insecurity mean? It's defined as a household level economic and social condition of limited or uncertain access to adequate food. And then it goes on to describe the rest. And so basically this measure is looking at if a patient was screened and then did the patient receive follow-up. So providers get scored basically on, did a screening happen? Did a screening get declined? And then it moves beyond that. So did the patient screen follow-up, or did the patient screen positive for any of these social needs, but no follow-up happened? Or did they screen negative? Or did they screen positive, but they denied the follow-up? Or I think the highest level scoring that could happen is, did the patient screen positive for a social need, and follow-up was conducted. So follow-up basically means that they were connected to resources to support these social needs, whether it is, access to food, housing support, transportation, utilities, whatever that might be. And within the actual measure, which I can share in the chat, it's a lot of detail. So I've been kind of trying to break it down a little bit, and actually that might not be the right link, and we can send this in follow up as well, but I basically, so CMS opens up measures like this, so they share the measure out and then they ask for public comment. So what are your initial thoughts about the actual measure? What will work? How can it be improved? Which is a great way to really understand, from providers' perspectives, from patients, from anybody who will be impacted by the measure, what can be improved about the measure. So when it is implemented and they start scoring based on the screening and the follow-up, that will, impact everyone positively. I don't know if I did the best job of describing it, because
I think you did a great job, Lindsay. Can I add a little bit more context?
Yeah, please do. I don't think I gave too much background. Yeah.
No. I think this is really great. So, and for those of you who are unfamiliar with the terms social drivers of health, those are those things that the health system is recognizing as impactful to a person's well-being. So, obviously food, nutrition is impactful to somebody's well-being and health. Housing insecurity has been, evidence shows us that insecurity in housing and either being on the streets or being uncertain of their housing status really contributes to a lot of negative health outcomes. And so that's the terminology, social drivers of health. And so I guess what I kind of just wanted to share is the fact that this measure itself is a huge step forward.
Mm-hmm.
So I want you, when you go in and review these measures, to think about, when you're thinking about, how does a hospital or a healthcare provider, how do they provide a resource that would support someone to having more security around food? That's really the goal of this measure. And so I want you to absolutely give all of that input. But I also just want you to recognize that this is an evolution in the health system and thinking about a person's health in the context of their lives versus in the context of the hospital or the health center. So I absolutely encourage you. And Laura, I know we had a talk last year, I think, about the importance of the public and you and I and all of us on this call to have to participate in open commenting periods, because this is a really great opportunity to influence healthcare policies, healthcare systems and measures. And what gets measured is what improves, right? We know that. So this is a really important opportunity. And Laura, maybe we can share the recording of that session where we talked about public comment, what it is, how to do it, how to write to it and whatnot. So really big opportunity. I see Marty has her hand up.
Yes, I do, Libby. I think one of the things that I have been involved in are hospital safety nets.
Mm-hmm.
And also using patient navigators throughout the system to help identify these and make sure that these are being done. Also, hospital to home programs that are now becoming quite popular, where patients are, rather than being admitted to the hospital, admitted or being cared for with hospital care at home with a backup thing. These for social need domains are becoming very, very, I guess I'd have to say they are coming to the forefront as being designated as things that people cannot do without.
Mm-hmm.
So I don't know, I like the measures, happy with the measures, but I think the important thing is, where can we put these measures to practice within the systems? And I think those may be some of the ways. I don't know if that's any help.
Marty, you are absolutely bringing up a wonderful perspective to put into that commenting period, right? You're thinking about not only is the measure itself, but where is it going to go into the system and how are we going to disseminate it based on the work that you're doing and the things that you're seeing. And I think that's the kind of out of the box thinking that patients and family caregivers bring into these commenting periods. Thank you, Marty. Great perspective.
And happy
Yes,
to talk
thank you.
further if you need to.
Yes, yes.
Yes, please. I think, I know we're close to the end of the time here, but would love any additional perspectives. I think it would be great to kind of comment as a community. And I'm happy to submit a comment on behalf of the PFA network. So if you have, any additional thoughts or ideas, anything to add, Marty, I'd love to hear a little bit more. You could definitely send me an email and I'd be happy to kind of pull it all together. Thank you, Libby. I was about to do that.
Lindsay, this is Karen Fernandez, and I'm on the Technical Advisory Committee for these measures. And I've been reviewing our last minutes. And one thing they've added, which I think is really, really good, and that's homelessness, because we're experiencing that around this nation. And to get the quality metrics for this, they developed some ICD-10 Z codes,
Right.
which will help with our data collection. So we're going to be having a meeting soon on this, but I needed to share that homelessness has been added, which I think is nice.
Oh, great.
Yeah, that's good.
Yeah, I'm glad to hear that. Yeah, and the Z codes are part of that measure too. So thank you for doing that plug. Yeah. It's like, did they use the Z code? And I think it's really all around the Z code goes into more granular detail about the actual need. Is that correct? I believe.
Yeah, the Z codes, if the patient was screened, if they declined, if they were
right
positive but no follow-up, there's a whole chart here for these Z codes.
Yeah, great. Well, I appreciate the consideration. We can include the link to the actual measure and follow up and encourage you to dive in a little bit. It took me some time. I'm still trying to absorb it. Obviously, so welcome you to take your time. The public comments closed July 2nd. So we have a couple weeks and would love to add your comments to a community response or encourage you to share your own.
Awesome, thank you. And is that something maybe we can also add to the forum and people can write out?
Yeah, absolutely.
If you don't want it super public, but your comments, but you can add them. We'll put a post in the forum and you can add your comments there or email Lindsay. Well, thank you. We are just past the hour and I do have one more. The Sepsis Alliance has a survey out. Let me grab the link here. Survey out. They're looking to hear from folks who are caregivers or people who have experienced sepsis, and they want to know about the diagnosis and the treatment of it so that they can better diagnose and treat folks in the future. So they just want to hear your experience and through this survey, and again, they'll use that data for future treatment of sepsis. All right. And I think that takes us to the end. If you would like to present a coffee chat, feel free to email me. Oh, thank you. Email me. My email is there in the chat. Feel free to let me know and we'll get you set up to present a coffee chat. And thank you everybody for joining us today.
Thank you.
Thanks so
Thank
much.
you very much. These are very nice. I like them.
Good.
Thank you. Take care.
Take care.
Be well.
Yeah.